You must be Michael. So I'm feeling a little fixation right here. The spine, the cervical, the thoracic, or lumbar. And this.
There's no one like Dr. Bud.
We're gonna give it a little bit here. Let me just check. Oh yeah, that's the way I like.
Wow.
Hi, welcome to Ask Dr. Bud. I'm Dr. Bud, and today we're going to be teaching you about herniated disc conditions and degenerative disc conditions because it's a similar thing that's asked in my office and so many people suffer from it. Herniated discs are one of the most severe things that we'll see in a chiropractic office. They create the most pain, they require the most amount of treatment, and the most expense on the part of the patient to treat it. But it's a lot cheaper to treat it with chiropractic than it is to have $60,000 to $80,000 worth of lumbar surgery and rehabilitation that goes along with it. Chiropractic is very affordable for these particular conditions, and since about 90 to 95% of herniated discs can be helped or cured, the herniated disc condition, and put it into remission, that it really behooves the average person to try chiropractic first by a chiropractor that specializes in this condition. Not all chiropractors have the equipment or the skill set to treat a herniated disc effectively. So you want to go to somebody that really understands this condition thoroughly and has the right equipment to do traction and flexion distraction on it. So what we're going to talk about today is the actual condition itself. A herniated disc is a bulge of the annulus fibrosus of the disc. Now, this shows a normal disc spacing, which is generally about 1/2 inch, and there's a normal nerve opening that is created by the spacing of this disc, and so this nerve can go into the buttock, legs, ankles, and the feet easily and not be compressed. There's other things in this hole here, such as blood vessels and fat, but there has to be adequate space and non-compression of nerves that branch from the lumbar spine out into the body. So a herniated disc is actually a bulge, and there's several terminologies. There's herniated or bulge, and then there is ruptured, where the actual capsule of the disc is actually torn, and then there's what they call sequestrated, when it's like toothpaste has come out of a tube too far, and the toothpaste has run up or down your spine, and it's actually a space-occupying lesion that's so large that it has to be dealt with. So generally, chiropractic is going to deal with cases that are in that mild to moderate to moderately severe area. Once they've actually blown out and they've sequestrated, sometimes you're in the realm of neurosurgery at that point. So this would be a normal disc. When a patient develops a herniated disc, sometimes it's traumatic. They will have some kind of a lifting injury. They'll try to pick up something heavy. They'll be in a bent, twisted position. They'll hear something pop, or they'll feel something very, very sharp. Now, when this happens, usually within minutes to hours, they'll begin feeling something in the buttock, maybe down the back of the leg, and even into the calf or further down the leg. Your body will begin to contort. So instead of standing straight up, your body may lean to one side. You'll either lean to the one side or the other, and it'll be very obvious to your family and friends that there's something wrong with your back. You're moving very slowly, you're slightly bent over, you're leaned to one side, and you have leg pain. Now, if the leg pain is on one side and you lean to the opposite, that's a better sign than if you have leg pain on the right and you're leaning to the right. That would mean that your herniated disc is going medially, which is a far less good condition as far as prognosis for no surgery. Once you have a herniated disc, we have to find out just how big that herniated disc is if it doesn't go away within a week or two. So a herniated disc, we're going to show you this. This would be a degenerative disc along with a moderate herniation. So compare that to the one above it, the one in front of it here. This would be normal. This would be a thinning and degenerative disc with a specific herniation right there. So this is actually touching the nerve, which is going to shoot into a particular part of your leg, generally the back of the leg, the lateral and back of the calf, and sometimes even in the toes of the feet. So your typical pattern of a L5 herniation, or fifth lumbar, this is the L5 disc right here. So if this nerve was to get compressed by a bulge such as this, you're going to feel pain down into the buttock first, then down the back of the thigh, and then the more pressure there is, it'll go into the calf, and then eventually the outside of the right foot. That would be an L5S1 typical pattern. An L4, L5 pattern is going to be more lateral and posterior leg, and you may have numbness or tingling in the great toe or the web of the first and second toe. So if we look on the actual spinal model, this one shows a rather large herniated disc at the third lumbar. So this one is, this is a gargantuan herniated disc. If the herniated disc is smashing the bone against the nerve, if it's bad enough, that might be an emergency surgical condition if it's bad enough. But most cases are not like that. Most cases, these are patients that have had back pain off and on for maybe some of their life, and then all of a sudden it goes into the leg with a particular activity or a particular postural position. Herniated discs are the most severe kinds of cases that we see. So this is one thing that needs to be addressed right away, and generally people are going to be off work for days to a few weeks if they have one of these. You don't want to keep working with a bad herniated disc. If you're leaning and bent over, you're just not going to get any better. You have to lay flat, you have to get proper treatment, you have to ice your back, you got to wear a back brace, and they generally will get better. 90 to 95% of these cases, as I said, wind up not needing lumbar surgery. But if you happen to be one of the unlucky ones that has a huge disc and it's sequestrated and it can't be retracted back in with the treatment that we're talking about, then you may need the surgery, but most of the time you don't. So as I mentioned, this shadowing area shows you where you're going to feel symptoms in your leg. So if your symptoms are more buttock and back, it's always a better prognosis. When you have pain all the way down to the foot immediately, it's a worse prognosis. Doesn't mean it can't be cured within several weeks, but generally the average herniated disc takes 1 to 6 months to heal, sometimes longer. If a condition doesn't improve with chiropractic like this within, let's say, the first 30 days to at least a 20 or 30% level, we begin referring out for MRI, we begin referring out to neurosurgical consultation. Possibly the person might need epidural blocks if they're really having a hard time getting back to function. Herniated disc can cause a myriad of different types of serious symptoms, such as bowel and bladder, lack of control, sexual dysfunction, and just not being able to move or sleep or do anything comfortably. So when people are that bad and treatment doesn't make it better within a week or two, we generally are referring those people out immediately for diagnostic testing. Generally a lumbar MRI of a 3.0 Tesla scanner, and we start getting them set up for a neurosurgical consultation for second opinion. But if they're the general average sciatic type case or herniated disc, and they're actually walking around, they can drive themselves to the office, we're not really worried that they're going to get surgery right away. Those are kind of the bread and butter cases that a chiropractor sees rank and file through the human race. Those are very easily managed if patients are compliant with their treatment plan. So another thing that can cause sciatica other than a herniated disc would be a degenerative disc. So over here we have a complete degeneration of a disc which takes decades to form. And this would generally be in a patient in their 5th or 6th or 7th decade of life, where the disc actually collapses completely and it closes off the nerve hole chronically and progressively, and will cause off and on sciatica that generally gets relief with chiropractic, usually within days to weeks, and it'll come and go. So as we spread these bones apart, the nerve gets more room. We do a treatment called flexion distraction, which this table does, and we actually will milk and open up the hole here to get the disc moving apart from the nerve. So this is called flexion distraction technique. which is a specialty in chiropractic, and we have these tables in all of our rooms at Budincich Chiropractic, and it's very important if you have a herniated disc that you get the proper decompressive type treatment. Medical doctors in general seem a little bit too anxious to go into intervention type treatments with degenerative disc disease and herniated disc. We like to use conservative care for at least the first 4 to 6 weeks, and if we're getting good results, we continue on. If we're not getting good results, we refer out for epidural blocks, MRIs, nerve conduction studies, and whatnot. But as I mentioned, you have a much better chance of healing naturally with chiropractic care and healing within enough short period of time that's going to give you confidence to move forward. So the degenerative disc is a chronic condition that may have started out as a herniated disc earlier in life. So this is a really, really advanced one, but the typical one that we'll see in an average patient is one that's about half degenerated or 3/4 degenerated, and there may or may not be a bulging disc assigned to it. But you can't see this disc on a regular plain x-ray. You can only see the actual disc tissue on an MRI or a CT scan. So, of course, those are much more expensive to order, and they generally have to be approved by insurance, but because we have on-site x-ray, we can immediately see the condition of the height of the disc and postulate about how much disc bulge there is based on our anatomical testing and physiological testing of the patient, doing reflex testing, pinwheel testing, straight leg raising testing. So it's very, very important that we find out how advanced the condition is to know how we're going to manage it clinically. But generally, as I said, most of these cases don't end up in surgery. They have to be properly examined, a good history and a good workup, and of course the proper techniques and treatment. So degeneration of the disc is a drying out. It's a desiccation of the disc. It's flattening, which narrows the size of the hole that the nerve comes out of progressively. So if the hole isn't enough size when the nerve comes out of it, the nerve is going to get irritated. It won't get the proper nutrients. It will begin complaining with numbness and tingling and weakness in the leg. And it will progressively go down the leg the worse it gets. So the less down the leg the pain is, the better chance you have of getting well naturally. So herniated disc, acute condition, needs to be worked up. You may need an MRI. Degenerative disc, more of a chronic condition that comes on over time. Both of them are chiropractic conditions, but they have to be managed properly, and we have to find out how bad it is, particularly in the herniated disc case, to make sure you're not going to need a neurosurgical referral. So I thank you for being with us today, and if you have any questions, continue with some other videos that we have on Ask Dr. Bud, and thank you for tuning in to Ask Dr. Bud.